Hey everybody, it's Matt Shu at Upright Health, and I'm joined by Kristen and Josh, and today we are all muscles. So what we're doing today is showing you why we think about muscles more than bone shapes. This bar here we have dropped through a hole in the middle of this bumper plate, and it represents, I think the best representation is it's actually a representation of your femur going into your hip joint. Okay, so we're all muscles and we help control the motions of this bar. So if we want to move this bar anywhere, we as muscles need to pull it and actually act in sync. So right now I'm pulling it this direction. You'll notice Kristen, her work has to change, right? When we're in this position, she could kind of hang out, not a big deal. Josh can hang out, not a big deal. As soon as I start pulling, now Kristen's having to do a little eccentric work or work as she's lengthening from her starting position. Same thing, a similar thing happens if both Kristen and I start moving the bar this way, then Josh has to start dealing with what we're doing. Now, what you should notice here is that the shape of this joint is only very, it's not the primary concern in terms of how this bar moves. There is some friction happening there at the joint. There is contact going on between the insert that we have for the barbell and the bumper plate, but that's not determining how we're moving. How we're moving this long bar is with our actions, okay? So yes, this could affect it in some way, but the muscles are really the hugest movers and the biggest factors in terms of positioning for what's going on here. Another way to look at this is whether this is resting in a good position depends on how we're pulling on it or the forces that are acting on it. So just for the sake of, to make this clear, if we were all pulling a little bit too much that way, we would be exerting a kind of force on the joint in that direction, right? So at the joint, we would start creating some problems if we constantly had extra wear and tear happening on that side of the joint. But if we're balanced and we're able to move this in a fluid, smooth way all the time, it's not as big a deal. Now, what happens if, say, I am too weak? So what happens if we then start going there and I go, I cannot go farther than this, I won't let you go farther than this. Now we have a problem where one of the muscles is too weak, it's also too tight, and it won't allow these other muscles to function properly and allow for proper motion. On the other end, let's say Josh is too strong, and Josh is yanking, and now Kristen and I are now fighting to try to get this bar into a good resting position, but this guy won't let go because he's too tight and too strong. And you can see how happy he is about it. And
this is only half my strength.
I'm using everything. So now imagine if I'm doing this all day, trying to fight with Josh. Eventually, I'm going to tire out, I'm going to spasm up, and I'm just not going to be a happy muscle. Kristen's going to give up at some point, and then we just have really bad joint motion, and this bone is not going to be sitting where it's supposed to. Now, related to all this is joint popping, or like popping and snapping that people get. So Kristen and I have both had a lot of snapping in our hips and popping in our hips. And what did they tell you it was?
My snapping was right around here, and they told me it was delamination of the cartilage in my hip. It was just flapping away. It was my labrum just flapping away. It was so shredded, they said. But when I came here, Matt did some tissue work on the TFL, right, which is right over that area that I was feeling the snapping, and my snapping went away.
Right, so it's super important to think about where you feel the snapping happening. A lot of people think like, I feel that snap, and they've been told that's deep inside your joint, that's your labrum getting flip-flopped around. But if the snapping is somewhere that's not way deep in there, it's very unlikely that it's actually one of those joint structures that's flapping around. I've had tons of snapping and popping happen in my hamstrings. I would have it in my inner thighs all the time. It used to be really painful in my inner thighs. And so what's happening there, our theory anyway, is when you get these muscles that are too tight, let's say Josh is super strong again. So Josh is super strong, I'm getting pulled, and then we need to go over this way. Suddenly we get this kind of friction happening where muscles are starting to snap against each other. That's the best explanation that seems to make sense for the fact that you can make that kind of thing go away just by doing a little bit of tissue work and stretching, and suddenly that snapping, popping is gone. One other way we can demonstrate this, if we can lower this and pull this guy off. Let's set this guy down. So, just so you can visualize this one other way, I'm going to be the hip joint, I'm going to be the acetabulum, the socket, and then Josh and Kristen are going to be the muscles that help position. So you can see here's the ball of your femur, I'm the socket. That position is not at all dependent upon the shape of this ball or the position my hands are in, right? What's going to determine how that ball sits in the socket is really how Josh and Kristen move that bone, right? So we're saying this is now the head of the femur, that ball is sitting in the socket, and you can see, if Kristen is maybe the adductors and she's pulling that way, she's going to drastically affect the way that ball sits in the socket, which can then lead to issues in the hip. This is also true in the shoulder, right? This exact same situation can happen, and to some extent it can happen in the knee or in your elbow, but in the shoulder and hip, that's where it's going to be the most noticeable. If Josh is pulling too hard, he might ram that ball into my hand too much. If Kristen pulls too much, she might pull into a really unstable position. So that's why when we're looking at hip joints, when we're looking at shoulders, we're thinking about the muscles rather than the joint shapes. The joint shapes could have some effect, but it will be really small relative to what the muscles do and how the muscles affect the bone. So hopefully that makes sense, and hopefully that explanation and illustration helps you kind of visualize what's going on in your own body and why it makes so much sense to think of muscles rather than bone. Anything to add, guys? All right, cool. So hope that was helpful for you guys, and we hope that you remember that pain sucks.
Life shouldn't